right is the country head of the Pan American Health Organization, Dr. Gandhi, and they are going to support me on the technical issues of concern. I'm not a medical doctor, but I will read a statement, and then I'm going to ask the Chief Medical Officer to elaborate a bit more on what is read, and then we'll take your questions, and I'll be as brief as possible. So this is an update on our efforts to control or certainly prevent coronavirus from affecting our country and our people. So between January 23rd and February 8th, 116 persons arrived in Jamaica who had been in China 14 days prior to arrival here. One person had mild symptoms and was immediately isolated. That person's symptoms have since improved. Of the 115 remaining, 27 were not landed. So 27 were not landed. 78 have been assessed as having low risks and have been quarantined at home for follow-up with the local health departments. 10 persons up to February 9th were in quarantine in facilities operated by the Ministry of Health and Wellness. The purpose of quarantine is to closely monitor patients so that symptoms can be picked up early and the appropriate measures taken. This morning, just after 8 p.m., one person in quarantine, having spent approximately 8 days in quarantine, was detected to have had an elevated temperature, and as a consequence will be isolated as per our protocols. Samples have been taken and will be processed by the National Influenza Center and sent overseas for testing. This is the first time that we have detected symptoms in any patient or person who is being monitored, and have had to move a patient or individual from quarantine to isolation. This represents the first time that we have moved someone from quarantine to isolation. The ministry will closely monitor this patient for any further development, and we will of course advise the public as time progresses. This development, that is the approach to quarantining and then, if necessary, isolation, can be credited to the country's continued heightened surveillance efforts. And I want to pause here to recognize and thank the healthcare team for their diligence and overall monitoring of this situation. The ministry, as part of our collaborative monitoring and management of the risks associated with the new coronavirus, is expanding the island's capacity to quarantine individuals returning to Jamaica from China. The designation of St. Joseph's Hospital as one such facility forms a critical part of these efforts. However, we do note the concerns of the residents over the designation of the hospital for this very important purpose, and will make ourselves available to answer any questions or otherwise address any lingering issues they may have. And I intend to meet with those residents within the next 24 hours. I've been in touch with the Member of Parliament, and I'll do some follow-up on that. Of note is that we're engaged in ongoing efforts with stakeholders to identify additional quarantine facilities, and will advise the public of these developments. So we are having discussions at different places involving different locations, because we do believe that the quarantine method works, as evidenced by this emerging situation, which we hope will not result in any further health risk, but nevertheless the precaution is very necessary. The ministry and our stakeholders urge the public for its continued cooperation and collaboration as we work toward off the risk of the novel coronavirus, while also enhancing our collective preparedness for any eventuality. So that's a very short statement. I hope it captures the critical concerns and the need for us to call you together to inform the public. I'm going to ask now the Chief Medical Officer to elaborate a little more in terms of some of the technical details, after which you're well entitled to ask some questions.
Good afternoon. I would just want to reinforce the fact that the purpose of quarantine is to separate persons who have no symptoms under conditions that we can monitor what is happening to them. These persons may or may not have been exposed to the virus, but by virtue of where they're coming from, we're at risk of exposure. When we place persons in quarantine, what we want to do is to monitor on a daily basis and to ensure that if there are any symptoms that are developing, we pick it up early before the person reach to a point where they are coughing or sneezing and are more likely to be able to spread the virus. So in effect, the quarantine situation that we have now has picked up some early changes that we are monitoring, and as per our protocol, this person has been isolated. So under isolation conditions now, if this person continues to develop symptoms, then this person would be separated from other persons who they could pass the virus onto, and they will be nursed in a controlled situation to prevent any spread, either to other members of the public or to healthcare professionals. I want to just reinforce the value, as Minister has said, of the quarantine process. It's very important that we pick up these symptoms early so that we can isolate these patients. And it is very, very important that we have quarantine facilities so that we are able to, in keeping with the restrictions, the traveling restrictions that we have placed, that all persons that are coming back from areas where there is any transmission of the virus can be put in quarantine facilities.
Okay. All right, we'll take some quick questions. Anybody? Okay, I see nationwide and then okay.
All right, Minister. Jason Cross from the BU.
Yeah, Jason.
Residents are concerned because they say some businesses will have to be relocated. That's true, right?
Where is that? In relation to what exactly? The St. Joseph's?
Yeah.
Right. Relocated, you mean from the compound of St. Joseph's or in the vicinity?
In the vicinity.
I don't think so, but let me ask the CMO, the Chief Medical Officer, to comment on the St. Joseph's location and the perceived risks, because I think that's important to address clinically.
So the St. Joseph's Hospital compound is a large compound, and there is one specific area that we would want to use for quarantine. Not all businesses on the property are going to be affected. And so therefore, many persons are concerned about the medical center and the doctors that are operating there. They're also concerned about the casualty department. The medical center will not be closed. This is some distance away from where we are going to be quarantined or where we intend to quarantine persons. So we don't believe that there is any risk that is posed to these persons at the medical center. The casualty department is actually on the same building, adjoining the area, and therefore we are relocating the casualty department to the medical center. This will be able to facilitate persons who need to have emergencies, who need to come and see the doctor from 7 a.m. to 7 p.m. I believe that they are open. No, because the facility is at the medical center. We do not see a risk for persons being at the medical center. The virus is transmitted by droplets. The method of transmission means that the virus is present in droplets that come from a person's mouth as they sneeze or as they cough. These droplets will not land further than about 3 feet from where the person is. Okay? So therefore, there are several hundreds of feet between where the medical center is and where these persons would be quarantined. There are several hundreds of feet between where those persons are and where the roadway is. Several hundreds of feet between where those persons are and where other houses and business places are. We do not perceive a risk to the surrounding community.
One final question. Are cancer patients located there on the premises?
There are two possible areas where we can have persons affected with cancer that will access the St. Joseph's Hospital compound. One, there is a hospice that is located on the compound. That again is in a separate building from the area that we intend to quarantine persons, and is also at some distance from the area. We do not perceive a risk. The other area is where we have the Cancer Treatment Center for radiotherapy. So persons will access that through the separate roadway to that center. Again, we do not perceive a risk from those areas.
Okay, nationwide?
Okay, yes. So my question is, based on the development, is it being treated as a suspected case, or is it still just monitoring and evaluation of the patient?
Okay, for this patient has an elevated temperature, okay? It is not at the level that we would consider it to be a fever. What it is a progression, okay? And therefore a cause for concern, okay? So this person, the temperature may settle down, and this person, the temperature may continue to rise. What is important is that we have a rise in temperature in a person who has traveled to an area of concern. The particular person has come from an area of China where there has been an increase in the number of cases. I think it is about the third highest province in terms of the number of cases. And so therefore we are not taking any, what's the word? Chances. We're not taking any chances. So what we have to do is to monitor the case very carefully. As I said, this is a progression of symptoms, and we can't say what is going to happen thereafter. However, we are testing. The sample has been taken, and it is going to be sent for testing. And then within another 2 or 3 days, we will get back that result, and we can either clear the patient or we continue isolation.
Oh, go ahead.
Are you in a position to say how many persons are now in quarantine versus isolation?
Okay, so Minister had mentioned it before. We have 10 persons that are being quarantined in a government facility, and we have 78 persons that are quarantined at home. I want to reassure everyone that the process of quarantining persons at home is not a simple one that we just send persons home. The homes are investigated by the health department. We ensure that there is adequate space for the person to remain far away from other persons, and we ensure that the person is educated as to how it is that they conduct themselves, how it is that they move around. We ensure that the family is also educated, and then the health department checks on this patient on a daily basis. Now that check may mean that the person may be given a thermometer, and they're asked to check their temperatures, and they're given a log that they monitor their symptoms. And this is reviewed by the health department on a daily basis. If necessary, the health department visits the home on a daily basis as well. Now, these persons, we have had cases where we have investigated home situations, and we have found them not to be ideal for home quarantine. And those persons have remained in quarantine in a government facility. So this is something that we're taking very seriously, and we're monitoring very, very carefully.
Understood. You didn't say how many are in isolation.
At present, we would now, with this one person that we're moving into isolation, we would have 2 persons in isolation.
Can you say the position of the previous person that was in isolation?
The previous person, okay, in terms of moving a patient to isolation, if they have come from an area of concern and they had any symptoms when they landed, we would have moved them into isolation. That is our protocol. And the symptoms, when we had put any symptoms, is out of an abundance of precaution, okay? This person was moved into isolation, but when this patient was assessed, it was determined that this person did not meet the case definition. Okay? However, because we had put the patient in isolation, the person themselves had some concerns, we have continued to monitor the patient in isolation, and the person will be discharged at the end of their 14 days of observation. That person, however, their symptoms have resolved and they are much better now.
Can we get your question? Yes. What me?
Felicia Williams here from CBJ. I have a couple of questions. The first one is the person showing any other symptoms. Can you say whether it is male or female? And the minister mentioned that test samples have been sent overseas. Like an estimation as to how long it will normally take. It will take because it's the novel virus.
Okay. Well, first of all, I just want to say that in Jamaica, we are developing our own capacity to test. Okay? As of the 12th of February, which is Wednesday, a PAHO team will be coming into country to train our laboratory staff to do testing. By the following week, we expect that we will have the capacity to test. Now, this is very fortunate for us because it's not every country is going to have that capacity. But because we have a national influenza center that is located at the University of the West Indies, we are fortunate to be able to be given this opportunity to be able to do our own testing. So in the interim, we have testing that has been done at CDC and at CARFA. So CARFA has now had their own training, and since last week, CARFA is the Caribbean Public Health Agency, they are now able to test. So we can send this sample immediately to CARFA.
And how long would it take to get it back?
Okay, the spin around time is 48 hours. Now, if there are some cases that we will get back the result in 24 hours, and that is when all the initial screening are negative, and they can give us a negative result. But if based on the initial screening, there is something that indicates that there may be a positive sample, there's a further 24 hours for the confirmatory test to be done. So in all, it takes us 48 hours to get the confirmed yes, and that is dependent on when our sample gets there. So from our sample gets there, we would say about 48 hours.
Whether or not the person is male or female?
The person, no, I'm not able to say at this time. Sorry.
And any other symptoms? The person showing any other symptoms? Or just elevated temperature?
Just elevated temperature now. And as I said, we continue to monitor this person. Mm-hmm.
Yes.
In terms of the isolation facilities and the quarantine facilities, could you describe what provisions have been made in these facilities? What is there to isolate patients?
What's the difference between the two? You're asking what's the difference between the two?
And just describe the provisions that are made.
Okay.
In each scenario.
Okay, so essentially for a quarantine facility, what we really need is that the person is separated from other persons and there is minimum contact. Okay, so we restrict persons who are in quarantine from going outside of their homes. Okay, for those that are in home quarantine. And essentially in a home, what you really need is just a room and an adjoining bathroom. That's what you need, okay, to be able to keep the person separate. Again, I just want to reiterate in terms of the general precautions, in terms of making sure that you keep your distance. 3 feet is what we recommend. The person who is at home who of course does not want to spread any possible thing that they may have to their relatives will take the necessary precautions. In terms of, some of them may wear a mask, okay, to prevent, if they're talking to their relatives or friends, they may choose to wear a mask. The washing of hands is very, very important, because any kind of droplets that get on your hand, you can transfer to your face, and you can therefore get it into your ear passages or into the eyes and cause an infection. So the washing of hands, making sure that you have that facility, and also for hand sanitization, if you don't wash immediately, that is also recommended.
In terms of the isolation, how are the patients isolated exactly, and what provisions are there
Okay. So in isolation, what we have now is definitely a more restricted conditions. So we would have a room that is essentially sealed off from the rest of the hospital facility or whatever facility it is in. Okay. And the most important thing, so it is like the person is in an air bubble. Okay, and they're maintained in that area. The persons who enter into that bubble have to be completely protected. Okay, so they protect themselves by wearing mask. They may wear a cap to cover the hair. They may wear face shield. They may wear gowns. It all depends on what kind of symptoms the person is having. For example, if you have somebody that is coughing a lot and there's a lot of droplets, then you are going to take more precautions. Okay, so the persons that are entering into that room to interact with the patient have to make sure that they're fully protected. So they usually don those personal protective equipment on going in, and then on coming out they remove all of those things and discard them. Okay.
Persons in isolation, are they in the same room or in separate rooms?
No, they would not be together. We would isolate persons separately. There are certain conditions under which we may isolate persons together. For example, if they're close family members and both are suspected to be infected and have the same kind of course together. So, we may choose to isolate persons like that together. But for the most part, we will separate persons.
Let me just say, if I may clarify, that in the first instance, in the first case, the initial person who came to Anato Bay, I think it was, that person had checked themselves in because they were concerned, having returned and had shown some symptoms. And then the medical staff took the follow-up position, which led to the isolation. In this instance, this individual came in from China, was immediately quarantined, as we are now doing with all persons coming in. And this is, by the way, is a Jamaican, okay, because Jamaicans are entitled, and I think that's important to note. If Jamaicans are entitled to return to their country. And so this is a Jamaican person. They were, however, subjected to the quarantine protocol, and having served 8 days, we felt sufficiently concerned to move to a higher level of which would be isolation. All right. Any other quickly? Yes.
Shanice Gibbs from Area FM. Have you identified an area for quarantine in Western Jamaica?
Yes, I understand that one facility has been identified. There's some work being done now on that facility, and more will be said on that soon enough. On the issue of quarantine facilities and the St. Joseph Hospital, I just want to make it clear that I do intend to have conversations with the citizens who are concerned. I do not want the impression to be given that we are not sensitive to those concerns. And I want to say that we are in dialogue and have been to find suitable locations at different places throughout the country. It's not very easy, but we are looking. And if the need arises or the occasion presents itself, then maybe some additional adjustments can be made. But as of now, I also want to reassure, based on the clinical advice, and the CMO spoke to it earlier, that the configuration of the hospital, the area identified, located for quarantine, is sufficient not to pose a risk to any of the citizens. And I just want to reassure them of that. We would not do anything to compromise the health and wellness of any Jamaican citizen in the carrying out of our responsibilities. And I think that needs to be made very clear. Any other quickly?
What of the training of the specific doctors and nurses who may have to tend to individuals in isolation or quarantine?
Same way you want to address that.
Okay. So we are continuously training in terms of infection prevention and control. And every year the ministry rolls out a training program for infection protection and control, okay? Specifically to the novel coronavirus 2019. And I just want to remind everybody that we are in the flu season. and the same precautions apply, okay? And so the same risks apply. So we have conducted quite a bit of training since January for healthcare providers and for all practitioners, and also for persons at or points of entry. However, this does not stop here. We will continue to train persons, and in particular persons that are going to be manning the treatment sites, the quarantine sites. We are rolling out more training for those persons. But I also want to mention that within hospital themselves, they also have their own in-service training that continues.
All right, I'll take 2 more questions and then we can follow up after. I know it's your prime time, news time, so yes.
This person is being isolated at St. Joseph.
No.
Where?
I just want to say presently that we have no persons at St. Joseph's Hospital, okay? And St. Joseph's Hospital was really targeted as a quarantine facility, okay? And that is for persons that are without symptoms,
yes,
okay?
But that person, where is that person being held now?
Presently, that person remains at the facility that we have quarantined, and they are being isolated there. We are now making arrangements, because as you can imagine, it takes some time to make all the necessary arrangements to make sure that all the stocks are in place. And even when the stocks are in place, because most of these facilities do have the stock, we have to make sure that the staff is in place. So we are making preparations to move this patient. And right now we have 2 options, because 2 facilities are prepared, and we're looking at staffing at either. Okay?
Okay, any final question?
Just how many facilities are being used now for quarantine and isolation?
Just how many?
Facilities are being used for isolation and quarantine?
In terms of quarantine right now, we only have 1 active facility. Okay? We are exploring other facilities, and hence our discussion for St. Joseph's Hospital. We have identified, as we said earlier, a facility on the western side of the island, and we are exploring more facilities that are there. In terms of isolation, every hospital has the ability to hold a patient for between 24 hours to 72 hours. After that person is there, then our national isolation area that we have designated is a National Chest Hospital. Okay? We have 2 beds at that area, and then we also have other facilities like the University Hospital of the West Indies, where we have additional beds. We are now exploring the other facilities. As you can imagine, most of our facilities for managing patients are open wards. And so we have to look very carefully at these facilities to ensure that whichever area that we select, that it meets the requirements. So right now, as we speak, we would have the National Chest that is ready, as well as the University Hospital. And we are exploring the others to see how quickly we can get those in place, just in case we may need them.
Thank you. I'm going to ask the Dr. Gandhi from PAHO, the country rep for PAHO, just to say a few words, and then I'll just wrap up. And then you can follow up with your questions.
Okay. I would just like to commend the Ministry of Health and Wellness for the work they have done and the response so far in terms of preparing for the coronavirus. I think that this speaks to the effectiveness of quarantine, because remember, the quarantine are for perfectly healthy people as far as we know. It's just that they have a small risk, and therefore it's important to keep them separate and in quarantine for the 14 days. But the effectiveness of picking up any change in their condition and isolating them, that is what is needed to contain the virus globally. So I would just like to commend the Ministry of Health and Wellness for the early and effective action they have taken. And we in PAHO continue to support the Ministry of Health and Wellness in terms of training, in terms of the laboratory diagnosis and increasing that capacity, and working with all our partners to ensure that we support the Ministry of Health and Wellness in their response. Thank you.
Thank you very much. So my closing comments will be brief. First of all, thank you very much for being here and for helping us to keep the public informed. I want to just emphasize again that this is our attempt to keep the public engaged and informed, not to spread panic or to fuel rumors. And I think that's very, very important because we have to, I think, ensure that we take an abundance of caution in our approach so as not to run the risk or enhance the risk of our population being affected by this novel virus, while at the same time continuing our responsibilities to the country and to the people of Jamaica so that we can all carry on in our normal routine. So this recent development, which involves this particular individual who was in quarantine, now isolated, and to be further isolated if necessary, is an act based on ensuring that we take maximum precaution to protect the population. And that's really what it is. But at the same time, we want to keep the public informed, hence calling you to the table today. So thank you very much. We appreciate the time, the effort, and the coverage. And we say to the Jamaican people, we will continue to keep you updated on this issue and our management of it. Thank you. All right. Thank you very much. Thank you. Thank you, ma'am. Ryan here. I have to go over here. Yeah. Yes, sir.